I am utterly appalled with the treatment I received today at the Academic Medical Center. This facility offers a wide range of services, including non-surgical spine care. They have board-certified staff that specializes in physical medicine, rehabilitation, including non-invasive treatments of spine disorders and injuries. Now, Dr. Green, who I'm in dire shock with at this moment, has specialty fellowship training in physical medicine and rehabilitation and detailed experience with non-invasive back and neck procedures. And before I get ahead of myself, I am currently seeking care at this facility because I had a horrible slip and fall at Publix. Because of this, I have chronic injuries to my neck and back and what appears to be long-term back and neck pain. Chronic. Now, back and neck injuries can cause pain that affects quality of life. And this facility is known to help you alleviate the pain and get people back to enjoying their lifestyles. I was assigned a provider who will help increase my strength and expand my flexibility. Now, stronger and more flexible backs are less likely to cause pain. Heat and cold packs are also a part of my non-invasive plan for my back suffering. Ultrasounds are used with vibration to heat and encourage circulation in and around my muscles, tendons, and bones. Then, everyone's favorite form of non-invasive treatment for back pain is the massage. A skilled massage therapist comes in and works wonders on my back. Well, today, upon entering the room, the attending physician, he gave me the regular spiel of the treatment and possible risks of today's treatment. But today was different. He told me that it is common practice to allow the resident to perform massaging procedures while they, the attending, just simply instruct. Now, my condition is chronic, and the slightest wrong move can have me in agony for weeks. Now, mind you, the attending physician has 25 years of experience performing these procedures. So I told the provider nicely that I'll prefer the resident to not do my procedure today due to my extensive hike this weekend, and I would prefer a more experienced provider for today. I didn't want the resident to feel incompetent, so I made sure I included it was because of my own negligence that I would need a higher level of care. Now, the attending physician proceeded to tell me that this is a teaching medical facility and the resident will be performing the procedure despite my feelings. My eyes literally popped out in my head. I couldn't believe that I was spoken to in this manner. Though he fully informed me of the risk involved in my proposed treatment, I was still in shock. I neglected the treatment, and Dr. Green still said, "Don't worry. They are first-year residents, but they have mastered a craft now that had took me 25 years and then pursued the ultrasound." Now, a week later has passed, and I can hardly walk without a sharp pain shooting up my back. I am now seeking a lawyer and will be suing Dr. Green for malpractice. Most medical procedures or treatments involve some risk. It is the doctor's responsibility to give the patient information about a particular treatment or procedure so the patient can decide whether to undergo the treatment, procedures, or tests. The process of providing essential information to the patient and getting the patient's agreement to a certain medical procedure or treatment is called informed consent. Doctors typically require patients to sign a consent form detailing the risk of any given treatment or procedure. But signing a form alone does not necessarily prove that the patient gave informed consent. The doctor must actually discuss the procedure and risks with the patient. And the patient must understand, to the extent possible, the risks he or she faces. Whether or not a patient gave or gives his or her informed consent to a treatment is crucial in the law of medical malpractice. If a doctor does not get a patient's informed consent and the patient would not have opted for the treatment, if he or she knew about the risk, the patient may be able to sue the doctor for medical malpractice.